So good morning, good afternoon, good evening, wherever you're located. My name is Alice Rothschild, and I'm on the steering committee of Jewish Voice for Peace Health Advisory Council. And I want to welcome you to our 16th webinar. Some 50 folks have registered, and we hope many people will show up on this Sunday. I think it's Sunday everywhere that people are signing up. So the topic of this webinar is cancer care in the occupied territories. And what we're going to do is have a conversation about what it means to have cancer and live under occupation. And this conversation is going to be with oncologist Mariam Hussein and PHR Physicians for Human Rights Israel's Noor Asi. And just so you know, we do a webinar every 3 months. The next one's going to be in March, and we're going to be examining the suppression of information and analysis of Palestinian health in academic literature, and talking with several researchers who've actually had their articles pulled from academic journals due to pressure from Zionist forces. So the other thing is you will be receiving a survey after this webinar, and we really do look forward to your comments and suggestions, and we take them seriously. So the way this is going to work this morning is that Noor is going to do a presentation, and then Mariam and Noor are going to have a conversation back and forth. And I encourage everyone to be typing their questions in the chat. There will be no people asking their questions. It'll all be through the chat, and I will be monitoring the chat and then putting questions together and trying to have some stuff to relate back to the speakers. So after their conversation, which will go for maybe 40, 45 minutes, that kind of thing, then we'll go to the questions from the participants. Just so you know, this is going to be recorded and we will have it on our website and available publicly. So if you don't want to be on recorded Zoom, keep your cameras off and don't ask any questions, but I hope everybody feels ready to be involved. So let me introduce you to the speakers. Noor Asi works as a Freedom of Movement Coordinator at the Occupied Palestinian Territory Department at Physicians for Human Rights Israel, where she directly assists roughly 150 Palestinian patients each year whose medical exit permits are denied. And you'll learn much more about that. Noor studied sociology, anthropology, and gender studies at Tel Aviv University, where her focus was on intersectionality in the context of gender and occupation. Noor was chosen to participate in the State Department's Professional Fellows Program at the State House of Boston and United States Congress, where she provided input to the district representative on gender and intersectionality issues. Mariam Hussein is a physician and a public health doctor and a hematology oncology fellow at the Ohio State University James Comprehensive Cancer Center. She graduated from the Ohio State University College of Medicine and completed a residency in internal medicine. She received her master's in public health management from Wright State University, and she is interested in global health and cancer care, health disparities, and quality of life research. She is also the founder of Science Duma, a blog focused on the intersection of faith and science. So as I said, please write your questions in the chat. I will be referring to those later on. And I'm going to assume everybody has mastered chat at this point in the pandemic. And if you have comments or questions after the webinar, fill out the survey and let us know. So you're on, Noor.
Hi, everyone. Marhaba. First of all, thank you for having me today. It's really an honor to be on your platform. So it's 8 p.m. here, almost bedtime, but I have an amount of caffeine in my blood that I still be working. Just one note, if you see me having some bows in between, this is because I'm just good at translating on my head. So just a note. So I'm going to start with introductions for Physicians for Human Rights, Israel in general, then I'll be moving to our setting, talking about cancer patients in the occupied territory. So Physicians for Human Rights Israel stands in the forefront of the struggle in promoting a just society where the right to health is granted equally for all. BTRI was established in 1988 in the outbreak of the first Intifada. This is where our first mobile clinic operated to Gaza Strip as solidarity. Since then, we have been working on access to medical care and equal access for to the healthcare system for all those living under the Israeli control, talking about Palestinian living under the occupied territory, asylum seekers, asylum seekers, prisoners, most of them are Palestinians, and Israeli citizens with no access to proper medical care. Also, BHRI operates through humanitarian aid and policy change work to challenge the unjust policies we see that impact the health of our beneficiaries. So this is a brief introduction about our work as an organization, and now I will move to talk about our main conversation today. So I'll start with a personal story of a patient, cancer patient from Gaza Strip, talking about Abir Ashur, a 48 in age of 48. She was diagnosed with rectal cancer. I'm not a doctor, but I know that such cancer is really fatal to the patient, and the treatment on time is really required and urgent. So her partner reached out to us in December 2020 and January 2021. And I'm saying that her partner reached out to us since she really couldn't even talk or contact with anyone, since the cancer was already all over her body. So they reached out to us after she was prevented from access to the life-saving treatment, talking about chemotherapy and radiotherapy that's not available in Gaza Strip. She was prevented of getting her medical permit access and going to East Jerusalem, a Palestinian hospital, to Augusta, Victoria. Since he reached out to us, talking about what the work of our department or my position. So one of the things we do that we get calls from the occupied territory from patients that their request was denied or prevented. So they have to get a medical permit so they can go through the checkpoints/barriers to East Jerusalem. If we are talking about Gaza Strip, so they have to get a medical permit if they go anywhere. If they are going from Gaza, if they have to go to Jordan, to Israel, to East Jerusalem, or the West Bank. If we're talking about the West Bank, they have to get a permit, the same thing of going to Israel, Jordan, or Egypt. I'm talking about if they wanna, the places that they can get a treatment of the cancer. So after reaching out to us, we have started to submit petitions and pre-petitions to the court so she can get her permit. We are talking about a cancer patient, and that she was, as I've said, mentioned already, that she was late for her treatment for like 1 month and a half. As long as we have started working on it, in like 3 weeks, she get her permit and went and traveled. I'm saying traveled because going from Gaza Strip to anywhere, it's not like it's traveling. Since then, we have been working on her medical permits. Every time she got prevented, sometimes for 1 month and sometimes for 1 week. And this really exaggerated when it comes to May 2021, when it was the attack on Gaza Strip, where she was really delayed for getting her radiotherapy treatment for like, it was 2 weeks. It was for 11 days, the attack itself, but then all the passages were shut on the Gaza Strip. So after submitting a petition to the court, they started, the Israeli authorities or Israeli Coordination and Liaison Administration let the patient access from to go to the East Jerusalem. So since back then, as I've said, we did another petition too, in order she can go to East Jerusalem. In these times, all the time, her partner was, and I had a couple of conversations with her, talking about how the cut-offs of the treatment was really, really bad in her health. She was really tired. In addition to the fatal of the cancer itself, she had anxiety and stress all the time. If she's going to get, I mean, in psychological way, if she can get the permit next time or not. So in November, in this month, I got a call from her husband, and unfortunately, he told me that we lost her. And as I've mentioned, one of the reasons was the cutoffs, and all the time the whole bureaucracy that I'm going to talk about when I'm going to talk about now, that every patient in the occupied territory have to submit for getting a medical permit. So this is one of the stories that we have in our during our work, and this is not like an extraordinary, or I'm just choosing it because she did die or something. We really have a lot of such cases we are working on. I need some water. Okay, so now after telling you the story, I think I will be moving to the sitting so you could know more about the bureaucracy and the labyrinth bureaucracy that the patients have to go through. So many cancer patients are forced to travel for medical treatments outside of the occupied territory, as the treatment they require is unavailable locally. So as I've mentioned before, we are choosing the term travel because all the bureaucracy they have to make is like traveling from a state to another, or country to another, I could say. And what is the treatments that are unavailable locally to cancer patients are the life-saving treatments. We're talking about radiotherapy and chemotherapy. This is the result of the Israelis' long-standing occupations of the occupied territory, resulted in fragmentation and de-development of the Palestinian health system. The de-development is a direct result of the Israeli policies, blockade, and military operations. Moreover, since Oslo, Israel did keep most of the power with it, and leaving the responsibility for the Palestinian Authority. This includes economic burden for health services and the lack of health sources. So the chat is just got me out of, so I'm not reading questions. Okay, great. We will answer it after the conversation. Okay, so the impact of the development is clear both in our experiences and in statistics. Let me read for you some statistics from this year. In 2021, between January until November, BHRI received 67 requests for cancer patients out of total of 156, which makes it 42%. I'm talking about only cancer patients out of all in the occupied territory. In addition to this, the percent of the monthly requests for cancer patients out of total, according to the WHO, in 2021 is between 23 and 27%. So such high percents could show the need and the struggle that cancer patients go through, and the need to have an access to the life-saving treatments. So after getting an introduction about the occupied territory and cancer patients, I'll be focusing now on Gaza Strip and the ramifications of the blockade and how it leads for de-development for the healthcare system. We are talking about an economic blockade that affects the health system in Gaza Strip in a very horrific way. So statistics on Gaza Strip between January until November 2021, VHRI received 61 cases of cancer patients, which makes it 43%. This is only from Gaza Strip. And most of the cases we get is from Gaza Strip, since the restrictions on cancer in patients and the blockade makes it more harder to make the access more harder to medical care. So the situation in Gaza Strip is very dire as a result of the economic blockade imposed by Israel. When Israel controls every aspect of life, we're talking about movement, passages, the barriers, social and political determinants of health. This is where Israel forced a full dependency of the Palestinian health system, on its policy, relating the access to services and exercising the right to health. This economic blockade affects the health system in too many ways. This leads to lack of medicine, medical equipment, and as mentioned, the access to health on getting every time any patient must get a treatment that's not available locally, and we're talking about many of the treatments must travel out of the occupied territory and get a medical permit. So just to give you a sense of the limited capacity of the health system in Gaza, every year an estimated 9,000 patients from Gaza apply for an Israeli medical permit to be treated in hospitals. Talking about this, it's very important to mention that most of the patients from the occupied territory are referred to Palestinian hospitals in East Jerusalem and not to Israeli hospitals. Such as Al Maqasid, Augusta Victoria Hospital, St. John Hospital in East Jerusalem. So cancer patients on Gaza can get their access to health outside of the trip only after liberant bureaucracy. So I don't know to compare it to what, so I can really giving you a sense of the bureaucracy they have to go through, but we are talking about medical permits, appointments, financial financial coverage, if compared to like an American terminology, we could say like the insurance they have to get from the Palestinian Authority too. And we are talking about the appointments. It's not like I submit now for one appointment to go to Augusta Victoria as a cancer patient and I get it a day after. They have to wait for it for 1 month, or half a month. So too often they miss their appointments because their applications are denied or not answered in time. So even if they were lucky enough to get their medical permit, I mean, if now they did submit it and after 1 month they did get the permit, that didn't give them guarantee that they will get it the next time. They can have, it could be approved one time and the second time they apply to, it could be denied. So and all these cutoffs we see of the treatment, we're really practicing it in our work, that it really could lead to a lot of, I mean, it's very extreme to say a lot of to death most of the cases, but people really suffer from all these cutoffs. We're talking about psychologically and physically. So we try to challenge these cutoffs by demanding a long-term medical permit. So we could challenge the cutoffs of the treatment and the no guarantee of having medical permit by demanding this long-term permit for cancer patients. We did decide to take this forward, since we really see and experience what the cancer patients go through every time they have to submit for another treatment. And of scheduling for the treatments and applying for permits over and over again, all while, as I've mentioned before, facing the burden of anxiety experienced by anyone battling with cancer. Lately, we have published a newsletter relating this issue. We written to authorities, turned an international medical organization regarding this. And during our Q&A or conversation after this, we would like to think this through you. Of course, we see only by ending the occupation and the Israeli control in the occupied territory it can guarantee the necessary conditions for health for all living in the occupied territory. Until justice takes place, we will continue demanding the right and access to health, a proper health for the patients, including the right to have full access to medical services, and mostly, and it's very important to mention the life-saving treatments of radiotherapy and chemotherapy that is not available locally, and enjoy the highest standards to health as long as Israel continue to prevent Palestinians from guaranteeing their own right to health. I think for now, we can move to questions with Miriam.
Thank you so much, Noor. That was a great overview of, very sad overview, right, of what's going on in the occupied territory. So thank you so much for taking the time to do that. Obviously, it's very saddening to hear about that patient that you mentioned, that unfortunately, because of something like a permit, she wasn't able to get the treatment or the full treatment that she needed. As Alice had mentioned, my name is Mariam. I'm a fellow here in the States studying hematology oncology. So this hits very close home for me, because when patients come to us to get treatment, sometimes the things that are delays are, like you talked about, Noor, insurance, maybe, right? Just to make it run through there. But really just the delays are when can they get set up, an appointment set up for their treatment, right? You know, just so that someone else doesn't interfere with someone else's. Or can they get the port that goes into the chest area, right? And then scheduling that. There's never an issue with, am I going to be able to physically make it over to the hospital? I might have to drive, you know, but there's never the issue that I need a permit to get to someplace or that I'm not going to get treatment. It's just a matter of when, right? And then it's usually in a pretty quick, short period of time. The other thing is that when people come into the hospital and they need chemotherapy or radiation, they can get that here, right? There isn't a delay. It's not like the hospitals don't have access. And if you're in a rural hospital, where you don't necessarily have access to that, you can get transferred to a hospital that does have it. And so, sorry about that. And so it makes it very easy, right, to be able to get that treatment. So one thing that I just wanted to highlight that difference right now, because I know that there are a lot of issues with healthcare in the US, but the things that you talk about are obviously very different, right? And unfortunately are very extreme, what people have to go through. And so actually some people have actually been asking questions in the chat, and Alice, if you don't mind, I might just mention them right now, if that's okay. But one of the things that people have asked about is that I was going to say, like, how do people and their doctors find their way to you, Noor, and to PHR if they need help?
Sorry, again, the question?
Oh, no, yeah, no problem. Is that how do people who are diagnosed with cancer, who need treatment, or their doctors, how do they find their way to PHR if they need help accessing treatment or getting permits?
Okay, first of all, as the restriction of the barriers on the West Bank, the Israeli barriers in the West Bank and Gaza Strip, they can come to us physically. So they call us, they have our numbers. They reach out to us mostly by phone, by emails, by some colleagues that we have on Gaza or in the West Bank, and sometimes even in Jerusalem, since in Jerusalem too. So yeah, mostly it's in the phone. You know, they have another family that they know that they are going through this, they give them our phone. So it's mostly, I could say, friend of a friend.
Mm,
So,
okay. You had to get referred kind of with that. Okay.
Yeah.
And then you had mentioned part of it too, you know, about with permits and all of that. But what are, I guess, some barriers that you guys face with PHR and being able to give help to patients with cancer?
Mentioned the, sorry, I have to go to the first question. We only work in, I mean, as I've mentioned, there is a high amount of applying or submitting to medical permits. So we get only the ones that was denied. As I've said, we submit a court or a petition or pre-petition to the court. So yeah, it was very important for me to mention that only the denied or prevented for 1 month, half a month, we work on such permits. So again, the second question.
Yeah, no. So the other another participant, thank you guys for these questions, and please keep them coming in. So how does it specifically relate with children? You had mentioned the patient earlier, you know, was a older person, but how about for kids who have who are going through cancer treatment? What are are there any specific barriers they have? And then what are some issues they have receiving treatment?
So unfortunately and sadly to say that they have the same obstacles and struggles. Like if they are, first of all, they have to go with a companion, one of their parents. And actually sometimes, because most of the parents are denied by the Israeli Coordination and Liaison Administration, they must get some neighbor to go with them, or some auntie or some uncle. And this is like one of the saddest things that I could hear. A kid that needs her or her mom or her dad can't go with them because of such restrictions. Like it sounds like a privilege for I mean, it is sounds like a privilege to have your parents, especially in Gaza Strip, to go with you to the treatment. And there are some cases we have faced that kids did the travel out of Gaza Strip, and sometimes, as I've said, mentioned, the situation in Gaza Strip is more dire. So this is why I'm referring more to Gaza Strip. They really travel out of Gaza Strip to Jerusalem alone. So we did get a lot of calls, sometimes from the hospitals too, regarding this issue, because they were just so shocked that a kid, we are talking about 10 years old or 9 years old, by themselves there. So we did work, a principal worked on this last year, and we did have a petition to the authorities. We did write to the authorities. I'm not going now to get into details. We could inform you on this maybe later, but we have a really, we did work in policy change with the authorities about this, but we still having a lot of requests that some kids were denied from getting their treatment.
Oh wow, the kids being
I mean, in the first
yeah.
month I've started working, in maybe, yeah, in the first month or the second one, I've get a mother called me to tell me that her daughter was 4 months. She had to travel from Gaza Strip to Ramallah, and it was denied for 2 times, and in the third time she got the permit and traveled to Ramallah. And when I called her to check on them, she told me it was too late and they lost her. She was 8 months. So yeah, such things happen. And
8 months old, yeah. So I was gonna say that, do you see that I guess if you may have statistics about how many children pass away from cancer in the occupied territories. The reason I ask that is because for people on the call, childhood cancers are actually very treatable and very curable. Even so, the 8-month-old you mentioned, she probably had a leukemia. And in the States, we have a success rate of about 98 to 99%, depending on the type of leukemia. And if it's a harder one, usually more than 90%, if not 89% of kids will be cured, if not put into remission. So that's why I ask if you have an idea, because especially for a child, it's more treatable than in an adult.
Yeah, I do have an idea, and we do have statistics, but I don't have it now since this wasn't our main topic. But I would like to inform and send to you the information you need after this. But I don't have it now, but I could tell you that the percent is, you will be, I think, surprised from the percent we can give you. We do get a lot of requests regarding this issue.
Yeah, no, thank you. Yeah, that would be great to get some more of that. But yeah, just
I will write this to me.
Yeah, no, it's just extremely, extremely grounding, unfortunately. So one of the other questions that came up is that you mentioned the high percentage of cancer in the occupied territories. Do you think that this is actually an underestimate, that it's actually not it's not representing all the cancers that are in the Gaza Strip or the occupied territories because of the issues and the problems that you mentioned about occupation?
I mean, as I've said before, I didn't have research on it. I'm talking from my perspective as someone who's experiencing the work on the field. I could say it is. I mean, psychologically, it affects them, and I did tell you about this personal story of Abir Ashur, the beginning of my presentation, and I did hear from them how this is really adding to the anxiety she's already dealing with the cancer itself. She was all the time stressed, and we know how keeping yourself in a good psychological, I mean, to take care of your mental health when you have when you have especially talking about cancer. So we can see, and I mean, not only talking about mental health or the psychological effects, we could talk about the electricity on Gaza Strip. I don't know if you're informed about this, but people do have like 4 hours electricity per day. Sometimes when it's generous, they could have 8 hours. No water. So I think it's a lot of things in the same time. The cutoffs of the chemotherapy, radiotherapy, the psychological effects, living under a blockade. So a lot of people refer to it as an open prison. You don't have work. You don't have the minimum that you must have as a citizen of the world, not only as a Palestinian. So yeah, I think it has all the determinants of health is really not available in the occupied territory. But you know, it's very privileged to talk about this with a cancer patient on Gaza. Even me as a Palestinian, I don't start telling them, okay, you have to keep it slow to reduce the stress, because they are having a battle in getting the treatment, the medical treatment. So it would be like so elitist to start telling them, oh, take care of yourself, the anxiety you have. I'm doing it, not that I don't, but I'm
Right, yeah. No, and you're so right. There's so much research about the immune system and people's mental health, and I actually did a project in our clinic that with patients who have sarcomas or connective tissue cancers, and if they felt worse and had depression or fear, anxiety, they died more than patients who did not have that. So you're absolutely right about that. One question that came through, Noor, is so you mentioned that people are denied permits, but what are the reasons that they're given why? Like, why can't a mother go with her daughter, right, to get treatment, or parents, both parents, not just one?
You know, we do know, as I've said before, I'm not going to, we have just 1 hour and a half. I'm not going to deepen into politics and why they are sending this and not that. But we know how politics are used in order to oppress people. We see this, I guess, everywhere in the world, in every, maybe in another context. But in a lot of in a lot of cases now, for example, I have a case for a kid that I've been working on her case since February, I guess. She was denied as a security reason. That is not clear for us. What is it? We did petition to the court. They did remove the security one. And then they did say that her treatment is available locally. And then we did prove that it's not available locally. And then now we still getting, we did everything that about the available locally and the security, they did remove it. And now they just sending us all the time under process for like 2 or 3 months. So from our experience, this is why I'm telling you, just using it as a political thing, not more than this, because we are experiencing it in our work, in daily work, that there is not really anything about security or the availability of the treatment. I mean, if they have medical access to it, why do they have to go through all this labyrinth bureaucracy to get the permit? Why they have to add this anxiety to their life? So.
Right. So usually security is the reason that's given.
I could say,
that's usually that one. Okay.
And this puts us in a place where sometimes we have to ask the family, like, do you know where this come from? I mean, it is really a very hard position to be to. We have to communicate between a lot of we could say things that not everyone can understand in case to get the permit in the end of the day.
So a lot of issues, because it's not easy to talk. You want to maintain their privacy, obviously, and not talk about,
Sure.
So, I mean, obviously, another question that came up, really good question, is that for example, you guys are based out of Israel, with Physicians for Human Rights. Have there been other organized medical associations in Israel, like let's say the Israeli Medical Association? I'm not sure if that's the proper name or not, but have they, and not, you don't have to get political or, get into details, but has anyone outside of PHR made any statements about this obstruction of access to treatment, or any actions about that, like bills in the Knesset, anything like that?
First of all, not that I don't want to be political, but I'm saying what I'm talking about is already political. We're talking about cancer patients in the occupied territory. So this is no more political than this. But there's some questions. For example, this one, it's not under my position. So this is why I will tell you, I'm not going to tell it's political. I'm not going into it. I will tell you that, let me get back to you with the information. We have now 2 things. This is the second one.
Yeah, no, okay. No, I totally understand. And, I think that, and, apologies to our participants, but this is the issue, right? You can't go too far. You can't even talk too much about medical issues even, right? Without it being putting yourself at risk, or, turning, essentially putting your guys at risk. So thank you for at least, going as far as you can with the questions with that, Noor. So thanks. I'll send you an email, Noor, later, that somebody had actually offered to talk with you about the case of that child who unfortunately was denied treatment. So I'll send that over to you after this. So one of the other questions that came through is that, what are some of the common, so I mean, we talk about cancer in general, right, and the treatment issues. What are some of the cancer types that you guys see? or what are the more common ones you'll see? And you can break it up between men, women, kids, anything.
I could say we have a lot of what comes in my mind now. We have a lot of leukemia, rickettsial, lynx, but leukemia we have really a lot. So
I'm sorry, did you say larynx was the other one, or what was
in
this?
lungs?
Lungs.
Lungs.
Yeah. Yeah, so mostly it's and thyroid cancer. I'm not sure. Yeah. So you know, as a lot of for example, when I start having conversations with the patients and they start telling me where they feel things, for example, her stomach hurts her even before she was diagnosed, then she tells me like she has rickettsial cancer or something. So regarding your questions before, so I can see that it's really they have a disease that could be cured because they did have, for example, at first stomach pain, and then they was diagnosed with cancer, and then they have cut-offs. So, I mean, yeah, I can see from the experience that all the what's going on around this, of living under in the occupied territory, affects cancer really badly, and from the type of cancer that it's more common than other, such as leukemia and thyroid cancer and lungs. In kids, I could say that leukemia is really, really common.
Yeah. Do you feel, as a follow-up to that, the other person had asked that, or do you feel like, or do you guys see that there are maybe some cancers that it's easier to get a permit, or does it not matter?
No.
Any type of cancer?
With such authorities, they are all oppressed equally. Nothing gives you like privilege more than the other if you're a kid or woman or a man. No, I can't say that. No, it's a no.
Yeah.
I mean, I can tell you that cancer patients are not allowed to be prevented already. I mean, because their treatment is not available locally, but they still prevented and delayed from getting the treatment. So no, there is no difference. I could say that
to reiterate,
breast cancer for I don't know why I didn't mention that breast cancer is really common. We did publish, I could send you these stories. We did publish about cancer patients too. Sorry, breast cancer patients. So because we did really have a principal work in it. So that doesn't mean that they are not delayed or declined, but I can say, I couldn't say even it's easier to get a permit if you have breast cancer. But it's one of the cancers that, you know, she must get one. She must get out. But that's, I mean, sometimes they are denied for like 2 months.
Yeah, and then, yeah, no, completely understand. And then I was going to ask you something off of that too, but I think you already answered that there. So I mean, obviously something that's very front and center, and this relates to another question that came through, but the pandemic. So COVID, right? So obviously a lot of issues with that as well. Yeah. How have you noticed the pandemic affecting people's ability to get permits for their cancer treatment?
I don't know where to start to talk about this. It is really, I mean, it is really a big question. So we know how did the pandemic affect in general societies and countries. So imagine people that's already living under incubation. How did this affect them? It was really, really badly, and it's still actually. We still have ongoing petition to the High Court and vaccines that still not answered since like half a year. vaccines for the occupied territories. But talking about the freedom of movement and the cancer patients, and don't forget that in the same time, it was the annexation. If you remember in Trump government, the announcement of the annexation plan. Do you remember? Yeah, so.
Yes, I do remember that, yeah,
So
unfortunately.
it was adding, it was adding to the pandemic. Restrictions, this one too, and I will read you some statistics that I already have that BHRI received in the year of 2020. Actually, where it was a cessation of coordination after Israel announcement of the annexation plan. So to tell you more about this, there is the Palestinian Authority that the patients must submit the permit request to them first, and then if they are denied, they call us if they were prevented or denied. So BHRI received 391 cases, while 37% of them was cancer patients. This is in only 2020. And according to WHO, in 2020, 7,365 permit applications from Gaza patients submitted to the Israeli authorities. 40% of them was cancer patients. This is only during the pandemic. I mean, it was really, really, really bad, I could say in a very slang way. I mean, it was a lot of restrictions. For example, they were preventing people of getting to the treatment because they had corona, for example, or their sister had corona. So it was, as we talked before about this, how to use politics in preventing people from getting their basic rights. So this is one of the things that was used by the Israeli Coordination and Liaison Administration, that, for example, if you have your sister having corona, you can't go to the treatment. It was really bad on patients in general, and particularly in cancer patients. I did work during the pandemic, and after the pandemic, we still get calls from people that was denied for half a year or 1 year from getting their treatment because of all the pandemic restrictions. So the effect of the pandemic, imagine not living under incubation, so it will make it a double trouble if you are living in under the incubation.
So just to reiterate, just to make sure I keep my head around it, because even for someone like me who knows this stuff, so there isn't there is no access to treatment, cancer treatment locally in the occupied territories, or at least consistent enough. But then they refuse the permits because they say that you should get treatment locally, even though they know that treatment isn't there locally. And then second, with the pandemic, they will refuse permits because of COVID or corona or in the family, but then they aren't giving enough vaccines to the people in the territory so that they could not get COVID.
Great. You did have a brief on this. Yeah, this is exactly what I've said. And about the availability and unavailability of the treatments, it actually depends on the Israeli policies, which is changing all the time. But I could say that radiotherapy is prevented on Gaza Strip. It can't enter Gaza Strip. For example, they could have the first protocol of the chemotherapy treatment, but they won't have the second and the third one. So they prefer that the patients go already to the during the first one, and the same thing with the West Bank. There is already, as I've mentioned before, that there's a full dependency of the health system, of the Palestinian health system in the Israeli policy, and all the economic burden that the Palestinian health system is facing makes it, they have a lot of the lack of medicine and chemotherapy and radiotherapy. So this is why most of the patients are referred to the Augusta Victoria in East Jerusalem, which is a Palestinian hospital too. So even if they, let's say, get the first protocol and they travel from Gaza Strip to the East Jerusalem, and for example, they could prevent them in the second one or the third one. They could be denied several times. So this is why I've said we are working really hard work in challenging this during demanding the long-term medical permits. And during our conversation, I would like to think this through you. How do you think we can advocate this more, publishing about this? Because it's really, I mean, couldn't solve the whole problem. It is an incubation that has been ongoing for a lot of years. But this is like something that really could prevent deaths. It could prevent a lot of this whole bureaucracy of submitting for applications. We are talking about cancer patients, which means during 1 month, they have to submit 3 times for an appointment, which means your whole life is about submitting to treatments and imagining having a family that you have to take care of. So, yeah.
Right. And you know, with a lot of cancers that you need to have, sometimes people go through at minimum 4 months of treatment. And that's if you get it regularly, not having permits and where you're prevented from getting treatment. I mean, at minimum 4, maximum sometimes a year, if not more, right? That people need treatment. So this isn't just a one-time thing and then you're done.
Yeah. So one of the things that is a privilege to the Israeli authorities is having a companion with you during the treatment. This is like mind-blowing I mean, everyone should have someone with her or him during the treatment. I did see people, like I did volunteer with kids and men and women facing cancer, and I did see what they're going through. So when it comes to work now, and I see that a companion to be with a patient is considered as a privilege, and I have to tell this to the patient is like a really one of the heartbreaking things that we have to deal with as coordinations.
Right. You know, I want to make sure we respect everyone's time, and I want to make sure I give it back to you as well, Alice. So thanks everyone for the questions. And so I guess to leave off, Noor, how would you recommend that we support your guys' work at PHR? Because I know you do more than just cancer. You obviously deal with a lot of health issues, but obviously we're just focusing on cancer for this webinar. But what can we do to help, or what are some, you had mentioned things like long-term permits, or so that people don't have to keep replying. So what are some other areas that you think we can intervene and how we can help?
First of all, as I've said, like we would really appreciate it if you can publish about the long-term policy that we are trying, the long-term permits we are trying to challenge. But about more information, I guess we could talk about this more with our advocacy coordinator. But as talking about patients and cancer patients, we would really appreciate publishing about, first of all, if you would like statistics, I could send you, and about the demanding of the long-term permits, how important it is to the cutoffs. And
yeah, no, I think that's great. There's actually even just a couple of people in the chat who are offering to please send a report, and that they would love to help how they can. So it sounds like, a lot more, like you said, this is more time that we have to talk about these issues, and there's so much more to talk about. But I mean, at least for me, even like I said, even someone who's in this field, I've learned so much during this. So thank you so much for bringing the information and even just the personal side of this, because that's what really matters. So thanks everyone to the questions too. And Alice, I'll hand it back over to you.
So Noor, I was
just one thing, excuse me, I will send a link I think Ghada did send it already to the, yeah.
And what is that link about?
The cancer patients on Gaza Strip, and they will send you a link about the long-term permits too.
Okay. That would be great. Can you clarify when a patient actually gets to a hospital, like who pays the medical bill and who pays the transportation and who pays for if they have a companion, where the companion stays in a hotel, or whose responsibility is it to pay for all of that?
Okay, so the coverage of the treatment is totally on the Palestinian Authority. As I've mentioned, it's mostly referred to Palestinian hospitals. About the going to not saying like not hotels, they have some dorms for the patients. It is on the patients. The Israeli side do not pay for any things regarding the Palestinian patients or to the hospitals. So it's financial coverage from the Palestinian health, from the Palestinian Authority.
Yeah. Okay, and are there any more questions out there in webinar land there? Anyone else want to write into the chat? So while people are thinking of their last questions, when you say you petition the courts, who exactly are you petitioning? What court? Is there a court of medical decisions, or is it who are you petitioning?
Just a second, I'm just the ADHD is surreal with all the things that was open for me now. Okay, I'm focused. And actually long-term permits is on the chat too. So okay, so we did some bit petitions to the court for the ones that was denying the patients, which is the Israeli Coordination and Liaison Administration. They have different ones in the West Bank and Gaza Strip. So the one that was preventing or the patients from going to the treatment are the ones that we did some bit of court against.
So is it a national court, or is there a Tel Aviv court, or what court is it that you petitioned?
It depends, and it depends where is the treatment.
I see.
Yeah. So if it's in the West Bank, there's some bit. I don't want to say something that is not correct. I'm not a lawyer, but
it depends.
It's different. Yeah, it depends on where is the treatment.
So does PHR have lawyers that do this, or is this what your job is to do?
No. I'm not a lawyer. So we have lawyers that we work with.
You have lawyers that you work with. Okay.
And sometimes we go to the high court. That it's common to every district. If it's, for example, if we have a lot of breast cancer patients, so we did. This is, I've said, sometimes we have a principal work for policy change. If we get a lot of, for example, in 1 month, 15 breast cancer patients, so we could go to the high court if we do not get the permits to them from the court that is related to the district.
And I think, we need to mention that, this is all in violation of the Geneva Conventions and the protection of, medical personnel being able to do their work. And, all of this is illegal behavior on the Israeli part. And I think the other thing to mention is that not only with cancer treatment, but cancer workups. My understanding is in Gaza, there's the Israelis don't allow any radioisotopes, which makes it harder to do workups and follow-up. So that combined with the lack of chemotherapy drugs and the lack of just other drugs that people on chemotherapy need, or if they have complications, it's just patients are hampered at every level of diagnosis and treatment and follow-up. And if someone goes for treatment and then has a complication and they're stuck in Gaza, they're stuck. It's like then you're going to go petition for 3 months to get a permit for a complication that just happened. It's the brutality of it is really phenomenal and outrageous, I think.
Yeah, it is outrageous.
So how do you,
I really tried not to, not to be so, I don't want to say negative, but I'm sure like I tried to give like, not to say that, to give you the a lot of stories that is really happening in the field. We, as I've said before, we are really experiencing it, but this is even a little bit of a glimpse of what they go through. It's in reality, it's worse than this. I don't want to say 3 months. I said 1 month, half a month, but yeah, sometimes some patients must wait 3 months, sometimes half a year. I really worked in a case that someone waited more than half a year to go to Maqasid in East Jerusalem to get to go through a surgery. She wasn't a cancer patient, but she, like, as I've said before, they did say she has security issues, and then they said it's available locally, and then she did get a medical permit that it's not available, and then for like 4 months we were getting the under process answer from the authorities, and then she did travel out of Gaza Strip, so that means it was just nothing, and she could die during this time.
Right. And as Paula in the chat mentioned, there's not mammography screening in the West Bank and Gaza, particularly in Gaza. In the West Bank, there's some mammography, but it's very inadequate as far as I know. I don't know if it's changed at all. So again, even cancer screening techniques are very, very limited in Palestine. Is that your
And in the
impression?
occupied territories in general, and in Gaza Strip is forbidden, as I said earlier. In the West Bank, sometimes they have, for example, 2-3 machines or something, but in Gaza Strip, nothing has to do with radiotherapy is available.
And does PHR Israel think that let's say the level of toxic exposures in Gaza has increased the cancer rates? Is there data about that, or is that outside your purview? Or
there's no, like, we didn't have statistics or data about this research. We didn't have research about it, but we can say that, as I've mentioned before, the whole health determines effects that could affect the health. We can experience it in our work, in our experience of daily work. So, but I can't give you a number of statistics if it's right or not.
Okay. And do you want to have some closing statements, or do you feel like you've talked yourself out, or what?
I feel I have talked myself out. Actually, it's a lot of talking in the Zoom and a lot of muting. But I think I'm going to end with, of course, only by ending the incubation, and the Israeli control can guarantee the necessary condition for health to get the high standard of health. I mean, not to be privileged even to get the life-saving treatments, or just if you are dying to get out of Gaza Strip or the West Bank to get your treatment. I mean, it is only by ending, and especially the economic blockade in Gaza Strip, that it is really the ramifications on the people in Gaza Strip in too many ways. We're talking about the health system now, but it's in too many ways. It is affecting it. It's affecting the people badly. So I think I will sum it up like this.
So thank you very, very much for sharing all of this with us. And, we have huge respect for folks on the ground that are, in the struggle, trying to get care for these patients who are caught in this nightmare. And it takes a lot of resilience and persistence, and that's really quite amazing. And so I hope there are ways that we can support the work as we go forward. So at this point, I think we're going to end the webinar. I just want to remind people that you will be getting a survey, and also that JVP Health Advisory Council has a website, jvphealth.org, and we do a monthly media watch and a weekly COVID-19 timeline, and we do all sorts of other advocacy and writing. And as I mentioned, in March, we're going to have the next webinar. And if anyone wants to join, you can join via the website. So thank you very much and have a good day or evening or whatever time of day it is.
Thank you.
so much.
Shukran, Alice and Mariam and everyone. We are having good night here, but everyone has a great day.
Okay, thank you so much. Bye-bye.
Bye.